We are back on the Lynne Hayes Freeland Show. Sometime we could use an hour, but we don't have an hour, so we're going to keep it going. Dr. Rhonda Moore Johnson, my guest, healthcare consultant in the Pittsburgh area. FDA gave final approval to Pfizer this past week. Moderna could be going down that route sometime in the near future, Johnson & Johnson. Why is that important? Why does that matter?
Okay, so the Food and Drug Administration, that's what the FDA stands for, gave full approval to the Pfizer vaccine for 16 and up. 12 to 15 is still under emergency use authorization.
Okay.
So what that means, Lynn, number one, is that there has been enough data. Over 100 million doses of the Pfizer vaccine have been given here in the United States. So there's been enough data that they can review to find that it's safe and that it's effective at keeping people out the hospital, keeping them from severe COVID infection, and that the manufacturing process is of highest quality. So they look at all of these things and they look at all of this data before they get granted full emergency, full approval. Now, the 12 to 15-year-olds, that will likely get full approval as well. But again, they have to look at the data. And again, and they're looking for adverse effects. So that approval just came in May for 12 to 15-year-olds, whereas for 16 and up, that approval came in December of 2020. So probably in another 5 or 6 months or so, we'll see full approval for 12 to 15 for the Pfizer group. Okay. And I expect Moderna to get full approval once their data is reviewed. And we'll see about Johnson & Johnson. I'm not sure about that one yet.
Right. Okay. All right. So now, last week, the Pittsburgh Courier front page implied that 30-ish% of the Black community had received 2 doses, had received full vaccine. It's being debated. Is it accurate? Is it not? Either way, our numbers are not what they could be. Why do we think that is?
Well, I think you have to, and unfortunately we don't have this data, but I think if we tease out the data, overall, I believe that's accurate. And nationally, the CDC reports that only roughly 9% of all Black Americans have been fully vaccinated in the United States. Yes. So, but if you looked into certain age groups, if you looked at 60 and up, I think the vaccination rate among Black Americans is higher because, you know, when you look at who's getting vaccinated at the clinics that are in the Black community, you see a lot of adults. You see a lot of seniors. And so I think the rate among senior Black Americans is probably comparable to that of white Americans. But again, what drives Black vaccination rates low is because the younger people are not getting vaccinated. That's where we need to focus the effort on. That's who we're not reaching. And again, these are the same folks like we talked about before, who don't utilize the healthcare system, who rely on social media for their information, and who don't have a usual source of primary care. So we've got to do better reaching that 20 to 40-year-old age group.
So then does that have a domino effect? Because for the longest time, there was a lot of confusion about pregnant women getting the vaccination. Now, recently we're hearing that pregnant women should get the vaccine, but that's that same age group that we're talking about.
Again, there are many reasons why people aren't getting vaccinated. And I do a lot of education in the community, as you know, and what I always try to do is tease out the reasons why people are not getting vaccinated. And they're all over the place. One is concerns about long-term safety. Another concern was that, they were approved under the emergency use authorization. So I'm hoping now that the Pfizer has full approval, that more and more people who are young will go get on and get the vaccine. Again, the other reason is that they're concerned about, future fertility and possible effect on children, even though the CDC has actually looked at data. They released a new study in August 11th that looked at over 2,500 pregnancies. And they looked at women who got the vaccine who were less than 20 weeks pregnant. They looked at the rate of miscarriage in people in their early pregnancy who were vaccinated, and there was absolutely no difference in the rate of miscarriage among people in the early pregnancy under 20 weeks who were vaccinated and people who were unvaccinated. So again, there looks like there's no effect on miscarriage. That's a concern. Another concern people may have is that it can cause problems with the babies. Again, the CDC looked at pregnancy outcomes for women who received vaccines late in their pregnancy. Again, no problem with the pregnancy or the babies. So the vaccine is recommended for pregnant women at any stage in their pregnancy. And it's safe for breastfeeding women as well.
Okay.
What is harmful is to get COVID when you're pregnant, because again, your immune system is suppressed and your stomach is pressing up against your lungs, so you have less lung capacity.
Wow. Okay. That's one I haven't heard.
Yeah, so it's actually dangerous to get COVID while you're pregnant. So pregnant women, get vaccinated.
So we have about a minute left, and we could probably go on for another hour. This past week, Dr. Fauci said we could be looking at spring of 2022 before we're through this. What do you think about that?
We're looking at longer. Yeah. And I tell you why. Because we're all connected. We are just one international flight away from a variant. Our world is connected. Trade, food, things come from all over the place. And most of the vaccines, 90% of them have been given in 10 countries. So most of the world yet hasn't received a single vaccine. So, and COVID infection is on every single continent, including Antarctica. So we've got to get the entire world vaccinated, not just in the United States. And a lot of countries do not have an ample supply. Right. So that's why I think we're going to be dealing with this pandemic for, unfortunately, a little longer than spring of 2022.
Well, the upside of that is you and I get to do this again and again and again. Dr. Rhonda Moore Johnson, thanks so much for joining us today. Lots of good information. I wish we had more time, but I always appreciate your willingness to come on and talk with us and give us straight answers. That's what we need.
Thank you, Lynn.
All right. Thank you. We'll take a break. I'll come back and wrap all this up. Don't go away.